These are the following materials needed. So for the CPCMHI, the cord clamp, the sterile OC 3 to 4 pieces, the sterile cotton balls 2 to 3 pieces, the Mayo scissors, the bulb syringe, the tape measure, the vitamin K ampule, the thermicin eye ointment tube, the ICC syringe, the baby diaper, the ID band for blue for male, pink for female, receiving blanket, the digital thermometer, the baby's cup, weighing scale, the ghost neck lamp. And for the VSM MSI, the cord clamp, the sterile OS 3 to 4 pieces, the sterile cotton balls 2 to 3 pieces, the cord cutter, the tape measure, the vitamin K ampule, the thermicin eye ointment tube, the ICC syringe, the baby diaper, the ID band, blue for male and pink for female, receiving blanket, the digital thermometer, the baby's clothes, baby's blanket, weighing scale, and the goose neck lamp. Now proceed with the hand washing. Then after that, do the sterile gloving and do the double gloving. Hi guys, good day. So today I'm gonna perform the immediate newborn care. Wrist out. Wait, not. So it's male. So the baby delivered exactly 10:30 a.m. So when the baby is delivered, you have to dry the baby at least 30 seconds. So first you have to wipe the eyes of the baby, next the face of the baby, the front, the back, the arms, and also the legs and the other one. So do not wipe off the vernix caseosa of the baby. So do a quick check for the breathing of the baby while drying it if there's something wrong with the baby. So do not ventilate unless not breathing. Do not sanction unless the mouth not breathing. So and do not and nose is secretions. So then remove the wet cloth. After that you have to remove the wet cloth of the baby, this one. After removing it, after 30 seconds, if the newborn is breathing and crying, position the newborn prone on the mother's abdomen of the chest. This is important after delivering the baby. You have to position her or his in the abdominal of her mom or her mother. So after that, cover the newborn's back with a dry blanket. So you have to cover it. So after covering the back of the baby, cover the head of the baby using the bonnet. After covering the bonnet or the cup, after 1 to 3 minutes, properly time cord clamping, and first you have to remove the first set of gloves. So I am gonna remove the first sets of gloves for us to avoid any contamination with the baby. So I have to remove this. I'm done replacing the first set of gloves. So we have to proceed, or we have to check the umbilical position of the baby. Then after this, we have to stop the clamp and cord using a sterile plastic clamp at least 2 centimeters from the base. So I'm gonna get the plastic clamp, and we have to put the cord clamp. You can use your finger for the measurement. 3 centimeter. So it is. So now we are done putting the plastic clamp of the baby. So do not melt the cord towards the baby. Then clamp again at least 5 centimeter using Kili forceps from the base baby. So now I'm gonna use this. So cut the cord close to the plastic clamp. Place the hand under the cord of the OS on it. Then protect the penis or the scrotum of the baby, and also to prevent any injury from other surrounding area. So in the cutting cord, when using the surgical scissor, so the blunt portion should be pointing downward. So during the cutting, the position will be the downward. So then downward, and the sharp portion should be the upward. Then after that, this OS. So this OS will prevent the blood from coming and the contact with the baby's skin. And then if there's a little blood, you can apply slight pressure in the umbilical cord area for the baby boy. Now I'm gonna cut the umbilical cord of the baby. Oh, it's done. So as what I said, the using of the OS is if there's any blood or bleeding with the during cutting. So this is used for pressure the bleed. So place the identification band on the ankle, not rest of the corresponding gender. The ID band should contain the gender of the baby, the surname of the mother, and name of the mother opened and closed, then parentheses, date of the birth and time of the birth. So for in the CPCM HI, they are used to put the ID band in the left ankle, while in the Vicente Soto, in the VSMMC, they are used to put the ID band in the both ankles. It could be left and right. So let's put the ID band with the baby. For putting the ID band with the baby, so let the baby leave it to her mother into skin-to-skin contact. Then observe for feeding cues including tonguing, licking, and rolling. So point these out to the mother and encourage her to nudge, or the hand of the mother should be placed on the baby like this. The hand of the mother should be put here in the back or serve as a support for the baby. After the skin-to-skin contact or the feeding with the baby, let's proceed with the weighing, or we have to get the length and the weight of the baby. After 9 minutes, remove the baby from the mother's abdomen. So transfer the newborn to the work table, and transferring the newborn in INRs should hold the neck of the baby, while the other hand should hold the other extremities. With the newborn to the work table, be sure to remove all the linens and the bonnet, then weigh the baby naked in the weighing scale. In weighing the baby, your other hand should hold and watch the baby to prevent from falling. Be sure familiarize the weighing scale. After weighing the baby, transfer him to the working table holding the neck and lower extremities. So next, perform the physical assessment. For the Apgar scoring, they performed the anthropometric measurement. The head circumference 32 centimeters, the normal, and the chest circumference 30, and the abdomen 27, and the mid arm is 12. So the body length and checking the body length and the portion of the tape measure should be on the occiput area of the baby and slide according to the curve, the occiput to neck to butt to popliteal to heel. And the body length is 38 after the anthropometric measurement. Cover the head of the baby with the bonnet, then also cover the body. After the physical assessment and the Apgar scoring, proceed with the rectal temperature. Rectal temperature of the baby. So 37.5 Celsius. It's normal. So after this, we have to clean the temperature from cleanest to dirtiest. So I am done with taking the temperature with the baby. So we have to proceed with the vitamin K injections. So vitamin K ampule. So I'm gonna use the syringe. So I have to remove the cover of the syringe. So we prepare the cotton with the alcohol and also a dry cotton mentally divide in units, thigh into four, then locate for the upper outer thigh at the site of the injection. For the disinfect the sites with the cotton with alcohol, then hold a dry cotton on your finger, then remove the cap, then hold the thigh with your non-dominant hand, then inject vitamin K in 90 degrees angle. After injection, hold the syringe, aspirate, then check the presence of the blood, and if there's a none, continue administering the medication slowly. Then get the cotton, then cover the site while removing perfectly the syringe. So for more info for the CPCMHI, they are used to inject the baby in the left thigh and the FSMMC the right thigh. So let's gonna I'm gonna inject the baby the vitamin K. Didn't see anything bleeding, you have to proceed with the medication. Now we're going to apply the eye prophylaxis. The eye prophylaxis, in applying this, you have to retract the eye of the baby and exposing the conjunctiva, then apply the eye ointment from the inner cathus to the outer, then and repeat also to the opposite eyes with the blanket still put in the baby's diaper. Then after it, you have to expose the umbilical cord with the clamp to facilitate air drying and the fast healing of the cord. So I'm gonna put this for the baby on the other side. So you have to expose the clamp or the umbilical cord with clamp with the baby for fast drying. So now wrap the baby with baby's blanket. Look at the triangular of the blanket, then place the baby's head. So here I'm already wrap and cover the head of the baby. So after that, obtain the heart rate, disinfect the stethoscope, wrap the diaphragm to your hands to keep it warm, then check for the apical pulse, the normal heart rate of the baby 120 to 160, the normal rate, and check for the full minute and respiratory rate, then check the rising and fall of the chest area of the neonate. Then show the two baby to the mother's latch and the baby's mother's breast. To document the immediately after cord care and latch and after that do aftercare.